Good afternoon and welcome to Ken Cable 21. You are watching a live show that's coming to you by Ken TV. During the next 25 minutes, we're going to be discussing palliative care versus hospice care. My name is Lucy Aquino, and I'm the Chief Executive Officer of Hispanocare Inc., a program of Advocate Illinois Masonic Medical Center. And today joining me is Nicole Rizio, Palliative Care Nurse Practitioner at Advocate Illinois Masonic Medical Center. And thank you, Michelle, for being here today. I'm sorry, Nicole. Thank you for being here and allowing us to spend time with you.
Thank you for having me.
Well, that's great. I know that our show today is very, very important because this is something that lots of patients are talking about. And of course, that topic being palliative care versus hospice care. There is a difference between the two. We know that patients do have the right to make decisions about their health care, either for now and in the future. Federal law requires that you are told of your rights to make an advance directive when you are admitted to a healthcare facility, and the Patient Self-Determination to the Patient Self-Determination Act, which are laws and rules that are governed by the state of Illinois and in every state. So on that note, Nicole, what can you tell us about what is palliative care?
So palliative care is a program, medical specialty that focuses on quality of life and symptom management for patients, as well as being a liaison for patients and between them and the medical staff, and making sure that all of their goals and wishes are being addressed and met.
So obviously the goal of palliative care, as you mentioned, is about quality of life. That's such a big statement for such small words.
So what that means is that we really focus on making sure that patients, whether it's physical symptoms or spiritual symptoms or psychological symptoms, that they're all being addressed while patients are receiving their curative treatment. So for example, if a patient were to have cancer and undergoing chemotherapy and radiation, we would be there to make sure that they're getting all the supports that they need and all the side effects and symptoms that they have are being treated as well.
That's great. So, Nicole, palliative care and hospice care are obviously two different types of care.
Correct.
Can you please give us a difference in the descriptions of those?
So, palliative care can happen pretty much for any patient who has a terminal or significant illness that has a lot of symptoms that they need and that need a lot of support. But this can happen while patients are receiving treatment. Hospice is a benefit that patients who are no longer looking for curative treatment and just really wanting to focus on comfort, quality of life, and really trying to maximize their time and their quality and focusing on that only.
So, Nicole, on the hospice care part of it, does Medicare and Medicaid cover these services?
So Medicare covers 100%, Medicare Part A covers 100% of hospice. For palliative, Medicare Part A covers 80% of their services, and Medicare Part B covers the extra 20%. So both services are available to be and covered at 100% by Medicare for patients.
And Medicaid?
And Medicaid.
Okay. So it's really important because I know a lot, when we're out in the community and we're out there and we get these questions all the time about particular services. And as we have representatives at, for example, our senior health fair that's coming up this week too on Thursday at Advocate Illinois Masonic Hospital, even at those events, we constantly get these questions.
Right.
And sometimes it's harder for us to answer them because we're not the experts. Right. You are. And I know you guys will be there. So we're really excited about
we're very excited
having you there as well. But I know these are questions that are very important, and those individuals who are on Medicaid actually seem to think that type of service is not covered.
Every citizen, every person in America who is entitled to these benefits. So whether they have Medicare or Medicaid, they are or private insurances. Palliative care is not covered necessarily 100% by private insurances, but it is available to all people.
And obviously the goal here for both of these services is comfort.
Correct.
Nicole, who can benefit from palliative care versus hospice care?
So So patients that we often see who are benefiting from palliative care or using palliative care service are patients who have chronic, long-term illnesses that have a lot of symptoms. So we see patients with anything from dementia to congestive heart failure. We see patients who have cancer. Really patients who are requiring a lot of extra support beyond the standard medical treatment. And often patients who we see do not have necessarily a cure for their disease. We see often, like with dementia and congestive heart failure, they can be chronic illnesses. You can live a long time with them, but we can't cure them.
And during some of this care, obviously, I know that for many patients, special equipment, sometimes equipment is needed and things like that. Is that also covered as well?
During palliative care, unfortunately, it's not part of the palliative care services, but with hospice, all medical equipment, all durable medical equipment is covered by the Medicare and Medicaid for the patients. So all of that is also covered at 100%.
So important to know. I mean, this is such vital information for viewers, for those who are watching. Please know that our lines are open. If you have any questions that you'd like to have for Nicole or myself, please give us a call. The number's at the bottom of your screen. Nicole, I know as we're sitting here and we're discussing care, the importance of goals and care for individuals. I mean, this is something that we should all prepare for, and we should be talking to our families and physicians. So being said, what would be your first step? What would be your recommendations if someone found themselves in a situation such as this?
I think there are a lot of important steps. I think figuring out who is someone you'd want to make decisions for you. And I think that also a very important aspect of this is to know what treatments you would want. So to be very educated and get as educated as possible about whatever disease that you have, and talking with your family and your loved ones about how you would want to be treated and what treatment you would be open to receiving.
Absolutely. So Nicole, when you're admitted at a hospital and you find yourself with a family member in that situation, obviously needing to provide this type of care and plan for these types of things. And I know that later on we're going to be speaking with Marc as well, your coworker, who's going to be talking about advanced directives, which is so important as well. Something we definitely need to talk about and find out more about. But as you're planning on things like this, the patient has the right to ask for these things. The patient should be told immediately upon admission, right?
Definitely. So upon admission at every hospital, patients are asked in advance if they have advanced care directives, and a lot of times we see patients at Masonic because they or their family have requested to have us involved, that they're concerned, that they want to make sure that their voice is definitely being heard by the medical team, and so families and the medical team respects those wishes. So families and patients should always feel empowered to ask for our services and help when admitted.
So when these conversations are going to take place, when should they be held?
I think that as early as when you're healthy, prior to a diagnosis of a chronic illness, I think is the best time, because unfortunately all of us are open and susceptible to tragedy and to severe illness that's unforeseen. So it's very important, even as a healthy individual, to discuss with somebody what your wishes are. And for example, I have had long discussions with my husband about what I would want to be done for me if I were in a situation like that. And so that's been really important.
And that's such a hard discussion to have, because especially when you start looking at our young, and we start looking at, we kind of feel like we're supermen and superwomen and nothing's going to happen to us. But believe it or not, statistically, we have more accidents amongst our younger population, and who don't think about hospice care, palliative care, advanced directives, living wills, and some of the other things we're going to be talking about later with Marc, is that these things should be thought about. Okay. And we should think about them now.
Yes.
We start looking at this.
We recommend to all of our patients that, this is something that should be done as soon as you turn 18 and are able to make those decisions for yourself, let your family and your loved ones know what you would want those decisions to be.
Absolutely. So, Nicole, who provides palliative care and hospice care services? Is that something that the hospital helps to select, or is that something that a patient, a family member